The first surgeon ever to cut into a human head probably never imagined his name would echo through millennia. Yet somewhere, a Stone Age healer lifted a crude flint blade and pierced a skull, trusting that the hole would cure a curse or a concussion. We're about to travel back to a world where medicine was part ritual, part trial, and part desperate hope. Imagine a time before antibiotics, before anesthesia, before even a written textbook. In that darkness, a single act drilling a circle into bone became one of the most puzzling, widespread, and surprisingly successful procedures ever recorded. This is the story of trepanation, the ancient art of opening the skull, and what it reveals about the evolution of medical knowledge. For centuries, scholars have tried to fit ancient practices into a neat timeline of progress. They often start with a Hippocratic oath and jump straight to the Renaissance. That leaves a massive gap, where people were already experimenting with the human body. Trepanation fills that gap. It appears on every continent, from the icy valleys of the Andes to the sun-baked deserts of Egypt. The sheer geographic spread tells us something profound. Early humans shared a common intuition that the brain, when trapped or angry, needed relief. That intuition sparked a practice that persisted for thousands of years, long before anyone understood neurons or blood pressure. The first section explores where trepanation began and how it spread. Archaeologists have uncovered skulls with circular holes dating back to 10,000 BC in the Near East. In the Neolithic village of Çatalhöyük, dozens of adult skulls bear perfectly round openings, each about the size of a dinner plate. Across the Atlantic, the Chinchorro culture of coastal Chile left behind similar marks on their burials, suggesting that the technique traveled far beyond a single tribe. Even the ancient Egyptians, famed for their embalming, practiced trepanation on royal mummies, as revealed by CT scans that show healed bone around the incision. These discoveries aren't isolated curiosities, they form a pattern of convergent evolution. Different societies, without any known contact, arrived at the same surgical solution. Why would such a risky procedure become a cultural staple? The answer lies in the universality of head injuries and the desperate need for relief. Next, we examine the tools and techniques that made these operations possible. Picture a hunter-gatherer's workshop: flint knives, obsidian shards, even early bronze saws. These were sharpened to a razor edge, then used to scrape away the outer layer of the skull. In some cases, the surgeon would grind a circular groove, then lever the bone outward with a simple wooden wedge. The process could take hours, but evidence shows that many patients survived the ordeal. How could a person stay still for that long without modern anesthesia? Researchers believe that the ancient healers employed a combination of herbal sedatives, perhaps extracts of poppy or mandrake, and ritual trance. The patient might have been placed in a rhythmic chant, the sound itself acting as a distraction. Some skulls even contain tiny perforations that match the shape of a reed pipe, hinting that a calming vapor was blown into the nose during the operation. The ingenuity of these methods is staggering when you consider the limited resources at hand. The third section asks the crucial question: why drill a hole in the head at all? Ancient texts and burial customs suggest a blend of practical and spiritual motives. In many cultures, the brain was thought to be a container of evil spirits or excess blood. A head wound, a seizure, or a sudden bout of madness was interpreted as the skull pressing on the mind. By creating an opening, the healer aimed to release the pressure, let the spirits escape, or allow the blood to flow freely. In the Andes, trepanation was often performed on warriors who suffered blunt trauma in battle. In Europe, skulls with healed trepanations are frequently associated with individuals who lived long lives after the surgery, implying that the procedure may have alleviated chronic headaches or post-concussive symptoms. The practice also appears in shamanic contexts. Some burial sites contain trepan skulls placed beside ceremonial artifacts, suggesting that the act itself held a sacred significance beyond the physical. The dual nature, medical and mystical, made trepanation a powerful tool in the ancient toolbox. Survival rates provide a surprisingly optimistic picture. Skeletal analysis reveals that many trepan skulls show signs of bone regrowth, indicating that the patient lived for months or even years after the operation. One famous example is the skull of the man with the 2 holes from the Neolithic site of Sennacherib, which displays perfectly concentric circles and a smooth, healed margin. Modern CT imaging shows that the bone regenerated without infection, a testament to the body's resilience and the healer's skill. Some researchers estimate survival rates as high as 70% in certain regions, a figure that rivals early modern surgical outcomes. This challenges the common perception that ancient medicine was purely brutal and ineffective. Instead, it paints a picture of a sophisticated empirical practice. Healers observed what worked, refined their techniques, and passed down successful methods across generations. The influence of trepanation on later medical thought is subtle but profound. In the medieval Islamic world, physicians like Al-Razi described opening the head to relieve pressure, echoing the same rationale that ancient surgeons used. During the Renaissance, European physicians began to experiment with similar procedures, eventually leading to the development of trepanum, a specialized instrument for skull surgery. The lineage from flint-shaped circles to the modern neurosurgical drill is not a straight line, but the conceptual continuity is undeniable. The ancient practice introduced a fundamental idea: the brain can be accessed and treated directly. This notion persisted, even when the underlying theories about spirits and humors were discarded. In a sense, trepanation laid the groundwork for the modern field of neurosurgery, reminding us that even the most primitive techniques concede future breakthroughs. Now consider the ethical and philosophical dimensions. What does it say about humanity that we were willing to risk life and limb for a chance at relief? The answer may lie in our intrinsic drive to confront the unknown. Trepanation required a community's trust in the healer, a shared belief that the act could restore balance. It also demanded a willingness to experiment with the body in a way that feels almost reckless by today's standards. Yet the repeated success suggests that ancient societies possessed a keen observational mindset. They recorded outcomes, noted patterns of healing, and adjusted their methods accordingly. This iterative process mirrors the scientific method, even if it lacked formal documentation. It forces us to rethink the narrative that scientific rigor is a modern invention. Instead, it may be an ancient human trait, hidden beneath layers of myth and superstition. A surprising twist emerges when we compare trepanation to contemporary mental health treatments. Modern psychiatry often employs opening the mind through talk therapy, medication, or even electroconvulsive therapy, a literal shock to the brain. Ancient trepanation, in its own way, was a physical manifestation of that desire to release something trapped within the skull. Some anthropologists argue that trepanation might have been an early form of treating mood disorders, where the pressure was interpreted as a spiritual or emotional burden. The fact that many patients lived long, productive lives after the surgery hints that the procedure could have alleviated more than just physical pain. Could it be that our ancestors had a rudimentary grasp of psychosomatic interaction, using a literal hold to symbolize and perhaps even effect a mental release? This parallel invites us to view ancient medicine not as a relic of ignorance, but as a different language describing similar human experiences. We've traveled from stone tools to modern neuroimaging, from shamanic chants to clinical trials, all linked by a single, simple act: cutting a circle into bone. The story of trepanation is a reminder that medical knowledge is not a straight ascent but a web of experiments, failures, and unexpected successes. Each ancient skull tells a story of courage, curiosity, and community. It shows that even without microscopes or textbooks, early humans were capable of observing, hypothesizing, and refining techniques that would echo through the ages. What ancient practice do you think holds the next hidden lesson for modern science?